prostate disease is the only disease that men suffer that women don't suffer. Of course, it is only men that have prostate gland. It makes sense. Do you understand? Now, there is one thing about prostate disease, especially prostate cancer, that most people don't know about. There is one thing that why it is very, very dangerous. And in this video, I am going to be telling us about diseases of the prostate, especially prostate cancer, and how to find it or detect it in time, because early detection is very, very paramount in the management of prostate cancer. Help me to share this video so that it can get to as many men as possible. Now, I want you to understand, there is a particular age a man will get to. Then that man is supposed to do a particular test, and that test will help to detect whether there is a problem associated with the person's prostate. So in this very video, I will tell you about that very test and when you are supposed to do it as a man, and how often you should also do that test. Help me to share this video. Thank you so much. I want to welcome you once again to my YouTube channel. In case this is your first time of joining me, my name is Dr. Eze Chidebere, and on this channel we discuss about health issues, importance of exercising, and other pressing issues within our community. Thank you so much for joining me today. I want you to feel free on this channel. Feel free to drop your questions, drop your comment, ask any questions as relating to your health issues, and I will attend to you at every point in time. You can also feel free to chat with me on Facebook. My name on Facebook is Chidebere Eze. You can also reach out to me on Instagram and TikTok as well. The same Eze Chidebere. So at every point in time, I want you to feel free on this channel. Thank you so much as we discuss this important health issue today. You are welcome. You are welcome back. Now, talking about prostate and its diseases, there are three major prostate diseases. Number one is infection of the prostate, otherwise called prostatitis. Number two is benign prostatic hyperplasia, meaning that there is enlargement of the prostate, but it is not cancerous. Then you now have what is called carcinoma of the prostate. So these are the three major things that the prostate may suffer. So, and it is peculiar to men, more common in a particular age group of men. Now, what are the features? What are the common features to most of this? When a man starts having what is called frequency means that the man is urinating more and more often. Imagine a man that is used to urinate like 1 to 3 times in a day. When the man now starts urinating 6 times, 8 times in a day, then there is a question. Something is happening in the prostate. Something is happening in the system of that man. So something should be done for the person. Do you understand? Or a man that normally, if he feels that he wants to urinate, he will be able to hold it and then go to a place that is okay for him. Suddenly, the man now, if he now wants to, just feels the urge to urinate, the urine will start coming. Or before he gets to the place that he wants to urinate, urine will start coming out. You understand? He must go and urinate. Otherwise, the urine will come out. He can't be able to control his bladder again. Something is happening in the prostate. Or a man that normally he will wake up once in the night or 2 times in the night to urinate. But now the man used to wake up like 4 times, 5 times in the night to urinate. There is a problem. There is something happening in the prostate. Or a man that normally, as a man, we men, if we are urinating, your urine should be going straight. And sometimes you can even use it to draw your name on the floor. Suddenly, the urine is not coming out very well. It is now coming out like, say, it is crawling. There is a problem in the prostate. Or the urine will come and stop suddenly. That is intermittency. There is a problem. Or the man has to force himself in order to push out the urine. And after several straining, Sometimes urine you may not even come out. Then sometimes it may come out, and even at the point of straining, he may even defecate and pass out feces at the same time and embarrass himself in the public. A man that wanted to urinate and now is not defecating because he is trying to push out urine. Or after urinating, he will still be feeling that something is still remaining in the bladder. Then there is problem with the prostate. So these are the common features, common things that will happen in a man that will tell him that there is an ongoing problem. Now, at what age is a man supposed to go for a particular test in order to know whether there is a problem? If you get to the age of 40 and above, sometimes they may even say as early as 35, you go for a test that is called PSA, that is prostate specific antigen, so that you will know from that test whether there is a problem. And in a normal, if there is derangement in that test, you will now go for further evaluation. That means you're supposed to go and see a specialist. One of the reasons why prostate cancer is very dangerous is that it may not even give you any signs. It may not give you any warnings at all. Next you're going to see is spread everywhere. That is why it is important, if you get to the age of 35, especially if you have a family history of prostate cancer, to start checking yourself. From age of 40, every man should be going for PSA at least once in a year, at worst once in 2 years. Do you understand? So it is very, very important, because you may not even know that you have prostate cancer. Next you're going to see is that this man is no longer working. You'll be thinking that something happened. Maybe village people have attacked him, without knowing that what is causing it is prostate. That is why early detection, and that is why this message is important, so that you can help me to spread this message. Let it get to many people as possible. If you are a man, you are 40 years and above, and you have not gone for PSA, kindly do that. If you are 50, go and check yourself. Go for test, PSA, prostate specific antigen. It's important you go for it, so that if there is any abnormality, then further investigation and testing can be done, because they see that what? Health is wealth. Thank you so much as you have joined me today. Thank you so much.